yourself in the, if you could,
no, we're not doing that.
We just did something very strange. If you could introduce yourself in chat, that would be wonderful. And please keep yourself on mute. If you can have your videos on, it's really lovely to see you. If you have questions, keep putting them in the chat thread, and we will lift them out, and then we will field them to Keren when we have the Q&A time. We have been doing these mentoring sessions because we believe there's no point in reinventing the wheel. We feel that you can learn from the experience and wisdom of consumers who've been doing it for a while, which is why Keren's here today to speak to you about strategic consumer partnerships. She's been doing this for a while. I'm going to let her introduce herself in a minute, but before I do that, I would like your permission today to respectfully ask if I may interrupt you if conversations get off topic. Is that all right? Can I have a show of hands if that's all right? Thank you. Thank you so very much. I appreciate that. Before I pass the virtual mic off to Keren, we have in the room today, Declan. Do you want to just pop in and say hello?
Morning, everyone. Some of you may have met me before. I'm Declan. I work with HCQ on our specific projects.
And Declan will be helping with tech support. And Chelsea, do you want to say a quick hi?
Hi, everyone. Lovely to see you all. My name's Chelsea Gugard. If you need any help, please just raise your hand or pop it in the chat.
Wonderful. Keren.
Oh, thank you very much, Rima. And thank you for the invite and opportunity to help today. Declan, are you able to share the slides, please?
Declan, I might do that. It might be easier from my end. Just one second. Is that showing for everybody?
Thank you very much.
Thank you.
If you go to the, yeah, that's fine. I would also at the start also like to acknowledge the traditional owners on which we're all meeting, which for me is the Turrbal and Jagera people. So thank you. And if we go to the attendee slide, please. So this is probably out of date because it was done a few days ago, but basically I think we almost have representation from the 16 hospital and health services across the state, which is wonderful. So there's quite a big representation, and importantly, not just metro areas, but all our regional and rural and remote areas as well. So that's who is on the call. And we also know from the registrations that there's some newbies to consumer engagement. So welcome, and hope we don't put you off today, but empower and enable you. And for those who've been doing it for a while, I hope you can also learn a few things from my mistakes and things I've learned along the way as well. And those of you who are, you know, in the thick of things now, again, hope you can learn some stuff today from some of my experience. So about me, I'm one of you. So basically, I got started in this kind of brave new world. How old's my daughter? 14 years ago, probably 13 years ago, when I didn't even know what a health consumer was. My second daughter was born with a rare syndrome, and that led me to dive into the deep end of our health system. And she acquired tube feeding dependency as a result of multiple surgeries when she was little, and we managed to wean her from her tube and get her eating again, which took every ounce of my advocacy and health literacy and networking and all these skills I had to learn in the moment and in the crisis. And that led me to go, how can I make this better for other people and change systems? And I'm very proud to say that you can see the picture on the screen. That is me and my very amazing colleague, Claire Riley, winning the Partnership Award at the 2019 Health Consumers Annual Forum with the former DG, John Wakefield there. And that was for our work on tube feeding dependency. And Claire's actually doing her PhD in this topic now. So I'm also really proud about that, how a little health consumer can influence system change, even if it takes a long time. So that's me, one of you. And I then started volunteering in health committees and at the strategic level. And I'm a former co-chair of the Family Advisory Council at Children's Health Queensland, and lots of different avenues where I have learnt a lot of the stuff I'm telling you guys about today. So in the goals of the session, in the email that went out, next, please. This is what you, believe it or not, all signed up to. So I figure you must want to hear about it because you're here. So these are what we're hoping to cover today: what strategic consumer engagement is all about, expanding your toolkit, understanding contexts and structures and the power of those, knowing your sphere of influence, communicating impact, what to look out for and listen for, focusing on outcomes, and when things get tricky, how to find support and advice. So hopefully we'll have time to cover all of those at some level. Okay, next, please. So on that topic of our goal of what strategic consumer engagement is all about, this is what my plain English, next please, engaging at a strategic level means. So in plain English, engaging at a strategic level is all about having a vision. It's about having that clear, detailed picture of the future. If you like, looking at the picture on the left there, it's what's the mountaintop that you're aiming for and how do you get there? And it's about the big issues. So when people say strategic, all they're saying is, what are the big issues, the big picture? And importantly, that needs to be holistic. It needs to be not just about the short term, it needs to be about the long term, and it needs to be all the aspects of a patient, a health service, the community that the health service is supporting, and all the different aspects of that. And really importantly, whatever the goals and outcomes you're focusing on should be aligned to the vision. Otherwise, you're going to land on the wrong mountain or may not even get to the base camp of the mountain. So that's why being strategic, you always need to be, what's the end goal? What's the vision? And any actions and any activity you should be doing should be helping to achieve that vision. And if you do all of that and keep that in mind, you'll be strategic. It's not some dark art. It's actually, you probably don't realize it. You do it every single day and every single year. You do strategic action. And next slide. And that's because engaging at a strategic level is not just about at a corporate health service level. It's at all these levels, at an individual level, a service, a department or program of care level, and they're all interrelated and all interdependent, and no one is more important than the other. So if I think about the individual level and being strategic in health, that for me is when I go with my daughter to a surgery appointment. It's asking those holistic, longer term, big picture vision questions about why does she need it? How's it going to help? How does it help her outcomes? How many of you, you can show your hands, not that I can see you, how many of you have heard of the BRAN acronym? The benefits, risks, alternatives, and N, capital N for no thank you. If you are using the BRAN acronym at an individual hospital appointment, you're thinking strategically because you're questioning the outcomes, how it works, what's the benefits, what's the risks, and thinking what are the alternatives in a holistic way. So that's an example of being strategic at an individual level. At a service level as well, all those questions about what action it's going to help with the bigger goals, the bigger vision, the time frame, all are strategic level engagement. So on that, next slide, please. Why is strategic consumer engagement important? So to help explain that, I'm going to get you working. We're going to do a quiz. Now, I don't want to freak you out because it's going to be fun. And I thought the best way to help explain some of this stuff in a practical way is if we try and do some questions and then we'll go through the answers together. So Declan, are you able to put up, next slide, please, the quiz and the quiz link? And next slide, please. So when we do the quiz, I want you to think the questions that we're asking and we're going to answer is all about getting information for you, because information is advocacy. And it's like landing on a foreign planet or foreign country. If you don't know how to read the road signs, it's a lot harder, especially when everyone else around you that you're sitting at a committee table or navigating a project in the health service with, they all speak the language. So if knowing the context and legal and regulatory and the strategies and frameworks and performance measurement and org structures and pathways and escalation pathways are all tools in your toolkit that help you to be better at being a consumer and advocating for change and improvement at a strategic level. So that's what this quiz is about. So Declan, are you able to share the link with everyone, please?
Excuse me. Oh, Karen.
Yes. Oh, there it is.
Yeah, so did you want all of the questions launched together or separately?
Can we all do them one by one and keep going?
Yeah. Okay, so we'll start with Y partner then.
Yep. Has everyone got their own quiz up?
So
Yes.
Okay, thank you, Jeff.
So if everyone puts their answers in, then it will come into the answer that, Declan, are you able to share that?
Karen, Rima is driving that. So if you direct what bits you want done, I will do that for you.
So everyone will do the questions on their own?
Yes. And we'll give another 5 more seconds and then we will end the question and then we'll share the response. Is that what you want to do next?
Can we do them all at the end? So just do all the questions at once. Is that okay? So just, yeah.
It'll happen individually, unfortunately. That's just the way it's set up.
Okay.
Is it all right if I end it now for this question?
And then do the next one? Yes, please.
Yes.
And then we'll go through them all at the end. Thank you, Rima. Hopefully they'll be quick. And your first answer is often your right answer.
Karen, unfortunately, I have to share the results of the first one before I move to the next one.
Okay, that's fine.
So this is Y partner, that question.
Okay, I can't see it.
Declan, can you give me a wave if you can see the response to that? Chelsea can? Okay. So we've got most of the people, 81% of everyone in the virtual room has said all of the above, that it's good practice because of research evidence and it's legal and a regulatory requirement.
Okay, good. Next question.
Okay.
I'll talk to all them at the end, but yes, next question, please. Well done, everyone.
Just let them know that we're not. Karen, Prince Charles Hospital Consumer Engagement, we can't see any of those questions. So we can't find the link, I'm sorry.
Kate,
Kate's not, because she's staff, she can't be here.
she can be there to assist you. So there's no link, it's popping up on the screen. And I'm aware that there's a group of you there. I'll read out the question. What is the name of the Queensland legislation that mandates health service being a consumer engagement strategy? Declan, would you mind copying and pasting some of these questions from our Word document into the chat thread? That would be awesome. Thank you. Okay, here we go. So we'll end this poll and share the results. So Karen, we've got 83% of the people in the room who've said Health and Hospital Board Act 2011.
Perfect.
And 17% said work and health safety.
Great.
Okay, and we'll go to the next question, inclusions of engagement strategy. Okay.
I can read it out if you like.
Yeah,
So-
okay, that'd be great.
The Hospital and Health Board Regulation Act prescribes that a consumer and community engagement strategy must include the methods for carrying out consultation and the key issues for consultation with consumers and members of the community. Is that true or is that false?
If we all were in the live room, there would have been lots of conversations, but I've asked you all to mute yourself. So I'm assuming there's lots of chatter and discussions happening. So we've got 86% of the people in our virtual room who've said true, and about 13% have said false.
Okay, next. Thank you, Rima.
Frequency of engagement strategy.
Okay, so I can read it out if you like. So how often do health services have to update their consumer and community engagement strategies? Every 2 years, every 3 years, every 4 years, or once only? Because once it's done, it's done.
Okay, still some movement there. Last chance. So 61% of people have said 2 years, 19 have said 3 years, and about 16 have said 4 years.
Okay, good. Thank you. Next
Next.
question. Thank you, Rima.
Drivers of consumer and community partnerships.
Okay, so in Australia, what has been the biggest driver of consumer and community engagement in the last 12 years? A, the change of government, B, the COVID-19 pandemic, C, digital health, or D, the National Safety and Quality Health Service Standards? Kate, you're giving answers to everybody.
So most of the people have said the
D, perfect. Next, please.
what standard?
Okay, so the National Safety and Quality Healthcare Service Standards, there's 8 of them. Which number is the standard for partnering with consumers? The options are number 1, number 2, number 8, or number 5.
I actually sit on one of these committees, so I know what the answer is.
Great.
My aim is that everyone will know these answers by the end, because if you've got this lingo in your toolkit, you're starting to learn those street signs.
This is very interesting, Karen. We've got most people saying standard 2, but there's a sprinkling of others as well.
No worries. Okay, perfect. Next, please.
Last question.
Oh, there should be more. That's number 1 again, I think.
That's it. Hang on. Sorry, just they're all the ones I have.
Oh, okay.
Mm.
That's all right. We can go.
Declan just put the next one up in the chat.
Oh,
Yeah.
okay, perfect. Thank you. How many standard 2 partnering with consumer actions does a health service have to comply with? Number A is 4, number B is 14, number C is 10, or number D is, letter D, sorry, is 20. But we haven't got the question to do, Rima.
It's not coming up on the poll for me, but I think we can do it on the chat thread. People are responding in the
Okay, no
chat
worries.
thread.
Okay, no worries.
Yeah.
And the main thing is you're thinking about it.
So we're getting a variety of answers.
Okay, it's all right. There's a variety, so it's a bit of a mix there. Okay, so next question then, please, Declan. Thank you for pasting it in. Okay, this is question 8. We've got 2 to go. From July 2023, a health service could be assessed for their compliance with the National Safety, Quality and Healthcare Service Standards with 1 week's notice. True or false? Lots of trues there. Hopefully true. There you go. False. A couple of falses. Okay. Bit of a smatter. Next question, please, Declan. Lots of trues there. Will a consumer advisory group, a CAG, or a consumer advisory council, a CAC, or whatever else the 3-letter acronym is, always operate at the strategic level of engagement? Got you thinking, haven't we? Hopefully. Some yeses, some no, unfortunately. Secretarial support, it's a good comment. Okay, last question, please, Declan. To be a health consumer participating at the strategic level, I must have A, a technical or clinical background, B, a university qualification, C, at least 5 years of consumer engagement experience, or D, none of the above. Okay. Mostly D, none of the above. Okay, thank you. That ends our quiz. So we're going to go through the answers together because, again, remember, this is about things for your toolkit and information advocacy. So, Rima, are you able to put back the slide deck, please? And the goals for today. The next slide. So back to the slide before, please. So when we're going through the quiz answers, I want you to keep in mind our goals for today and expanding your toolkit and understanding context and structures and knowing your sphere of influence. Because if you understand these answers, hopefully that will help you, because of the extra information, advocate more strongly, more confidently, and know the language of the foreign country that you've landed in sometimes when you're being a consumer engaging at the strategic level. So let's go to the answers, please. Next slide. So I think we had 80-something% got this right. So it is good practice. There is lots of research evidence about partnering with consumers and how it makes for better patient safety and quality and staff satisfaction and patient experience better, and also better value and cost savings for health services. So all of that's true. And it's also a legal and regulatory requirement. So all of the above is the correct answer. So it isn't just good. There's not just research, but sadly, a lot of reason why health service and engage is because they have to. They cannot act. They will not get paid. They can go to jail or have serious repercussions if they don't follow the Hospital and Health Board Act and regulations. And the way I look at it is the legislation tells people what to do, and the National Safety and Quality Service Standards say how to do it and make that quality and effective. So next slide, please. So knowing that, again, is information that is empowering. So the name of the legislation that requires hospital and health services to have a consumer engagement strategy is the Health and Hospitals Board Act 2011. So it's not just an enlightened board or health service that has a consumer and community engagement strategy. They have to do it. And if you really want to know, it's sections 40 to 43 of the Hospital and Health Board Act that tells them how that is meant to be done. And I didn't know this until a couple of years ago. Okay, next slide, please. So on that, here's that section. So it says a service must develop. They have to have 3 strategies that are legislated, and the health equity strategy for any Aboriginal and Torres Strait Islander members who are joining us today, you will probably have been involved or know this, that the Hospital Health Board Act was amended last year or the year before to require a health equity strategy. So that's why hospital and health services have done a lot of work in the last 18 months or so to develop a health equity strategy. But for consumers and the community, they also must have a strategy, and they have to consult with us when they're building it. And so that's the driver. So it's not a nice to have, they have to do it. And if they're not doing it and doing it properly, you know you've got legislation in your toolkit for why they have to do it. Next slide, please. So is there a regulation that supports the Hospital and Health Board Act? Yes, there is. It's the 2012 regulation. And it also says how you're supposed to do things and the key issues for consultation. So it's quite prescriptive. So if you go to the next slide, please. Here's the section from the regulations which says these are the key issues in which consumers have to be consulted on, and it's things like the service planning and design, service delivery, and also how they monitor and evaluate things. And also how the service will actively identify and consult with particular consumers and members of the community who are at risk of experiencing poor health outcomes. So they have to have an equity lens. And if you read the rest of that regulation, it also says about how they've got to monitor and show that they're making improvement against it. So really powerful information. If you're hitting roadblocks, you can use this stuff to say, hey, we should be doing this. And you may not use this language, but it should empower you to know that you have a right to have a seat at the table and you have a right to participate in an outcome and genuine, not tokenistic way to influence some of this stuff, because it's legislated that consumers and the community should be involved. Next slide, please. So how often do health services have to update their consumer and community engagement strategies? Again, this isn't a nice thing to do that, oh, isn't it about time we get everyone together and talk about this stuff? No, it's legislated and they have to do it. every 3 years. I know there was quite a few people who said every 2 years. It's actually legislated in the Health and Hospital Act 2011, Section 41, every 3 years. And you've got to have consultation about it as well. So you can't just do a refresh on the side. You actually have to consult properly. So again, that's what your health service should be doing. And you should know from this that they've got to engage properly. So next slide, please. So in Australia, what's been the biggest driver? I think most people got this right. Again, measurement drives behaviour. It would be nice if things happened organically because it is good practice, because of evidence that things work. But the biggest driver of consumer and community engagement has been the National Safety and Quality Health Service Standards, which if you're going to operate a hospital, private or public in Australia, you have to be accredited, and that happens every 3 years, that you meet these standards. Now, there's 8 of them. Next slide. And which one's the one about partnering with consumers? It's number 2. And it's helpful to know that, because if you know the language on those road signs in the foreign land on which you've entered as a health consumer in a complex health service, knowing that partnering with consumers, standard 2 of the National Safety and Quality Healthcare Service Standard, is a big thing in your toolkit that can help you navigate. It's online and there's so many resources there. And if you really want to help and get more skills in your kit bag, it's worth having a look at the resources and guides and stuff that's there. So how many standard 2 partner with consumers actions are there? Well, there's 4 criteria. A few people said 4, but the answer is actually 14. So when the standards were refreshed and updated in 2019, these were expanded and standard 2 was expanded. And so health services have to show that they have met accreditation for 14 specific actions for partnering with consumers. And the other thing to know is that there's 2 standards that underpin all of the other standards, and partnering with consumers is one of them, and the other one is the clinical governance standard. And that is also good information for you to know, because the intent is you can't do any of the other standards without having a partnering with consumer lens, which means partnering is strategic and is important for everything that the health service should do. And if they do it properly, they'll have better outcomes. So there's 14. So next slide. There's 2 to do with clinical governance and quality improvement systems. There's 5 to do with partnering with patients in their own care, about healthcare rights, informed consent, and sharing decisions and planning care. Next slide, please. There's 3 that are specifically to do with health literacy, and there's 4 to do with partnering with consumers in organisational design and governance. And those last 4 are particularly at the strategic end, because anytime you say governance, that is big picture, big issues, holistic, longer time frames, outcome focused, vision focused, and by definition will be at the more strategic end. So there's 4 specific actions that encourage and empower and require partnering with consumers at that strategic level. So this was a bit of a trick question. So the National Safety and Quality Healthcare Standards from July, can the accreditation be with a week's notice? And a lot of people said true, and it's actually false. And the answer is actually it can be 24 hours notice, not a week's notice. For a non-rural health service, it's 24 hours notice. And for a rural health service, it's 48 hours notice. So what does that mean, and how does that help you in your strategic consumer engagement? Well, importantly, the Australian Commission on Safety and Quality Healthcare, who run and develop and enable these standards, they've got cleverer, and they realised and a lot of you who possibly have been involved in accreditation and helping a health service get ready for accreditation around standard 2, you will know that the health service never looks so polished, and there's never more meetings and never more engagement than leading up to accreditation. And if you came back possibly 2 or 3 months or even weeks later, you may see a different health service. And it's a lot of work, and it can be very activity driven and not outcome driven. So the Commission has figured that out, and they've gone, this isn't helping anybody, because we want it to be about continuous improvement, and we want it to be about outcomes, which is, when you read these, the intent and outcomes feature heavily in all the guides that relate to these standards. So that's why from July, they can turn up with 24 hours notice to a health service. So it will change how your health service will work to meet accreditation. So question 9, will a consumer advisory group or council always operate at the strategic level of engagement? A few of you said it. No, unfortunately, no. And that's because, and I've taken this quote from the Health Consumer Queensland Consumer and Community Engagement Framework. Another thing I recommend is that generally the way health service engage is not an indicator of engagement, because a CAC or a CAG can be at the passive end of engagement and not necessarily being strategic if all they're being asked to do is, just read stuff and tell their networks without having any input into the issues that they're discussing and how to improve things, or issues that are important to them, and thinking about those bigger strategic, longer timeframes and vision that they think their patients and community would like. So ideally, a CAG or a CAC is being strategic and doing more collaborate type work and consumer-led type work, but they may not be. So that was a bit of a trick question too. Number 10, please. Last question. Do you need to have all these skills? They may help, they may hinder, but you definitely don't need them. And I've taken this quote from the National Safety and Quality Health Service Standards, their guide. They have a few guides. They've got one for Standard 2 on its own, and they've also got one for hospitals. And this is a quote: to maximise the contribution of partnerships, consumers need to be seen and treated as people with expert skills and knowledge, in the same way that clinicians and other organisational partners are respected for their areas of expertise. Consumer partnerships need to be recognised and valued for their unique perspective on the patient experience. We don't have to have a technical or clinical background or any other qualifications. Our qualification and our right to have a seat at the table is because of our unique perspective on the patient. And that should be, please know and have that in your toolkit. That quote, when you're sitting there feeling out of your league or not necessarily understanding what's going on, because you should have a right to sit there equally with the other people at that committee table, as the Commission intended. Next slide, please. So again, our goals: understanding context and structures and knowing your sphere of influence and communicating for impact. Next slide. So what are strategic issues for your health service? Because you can't be strategic if you don't think about what strategic issues are. So if we can just spend even 30 seconds just thinking about that, maybe putting in the chat what you think are strategic issues for your health service. So what are those big issues? What are those holistic issues? What makes your health service keep people up at night, or are most important for the people in your community? What are the long-term things that you would like? What's the vision that you would have for your health service? If you could wave a wand and in 5 or 10 years, what would that look like? Can we show the chat, please? Or I'm just not seeing it.
Are you able to see the chat, Karen?
Yes, I am. Thank you. So I'll read some of these out. Ramping, timely access, breast screening, targeted breast screening, service closer to home, so access, staff, health leadership, inadequate investment in facilities. These are great. Timely surgery, closing the gap, lack of empathy, more beds, long waiting lists, tokenistic consumer involvement, staffing levels, better outcomes for patients. Appointments, bed block. Yep. A lot of these things are on the news. Anyone know anyone having a baby at the moment? Maternity and the lack of obstetricians and, yeah, leadership issues, specialist staff, digital patient, digital records. Yep. Some really great answers here. What about COVID, keeping on going with COVID? And geography, integrated health records, person-centered care, trauma and violence. Okay, there's some really good answers there. Can we go to the next slide? Research. Yep, research, Liz, great one. We can't do better if we don't do research, that's for sure. So knowing your sphere of influence and communicating for impact. So just on the slide before, the word cloud. So I don't know if everyone was picking up a lot of those themes, but access, specialists, digital health, integrated care, leadership issues were all really good. And I think when you're going about your consumer engagement, if you can, before committee meetings or before whatever engagement, think about those kind of issues, about what's really going on, what are those big issues, bigger picture things, and also challenge you to think about some other stuff. I'm not sure if anyone has heard the terminology social determinants of health, but in plain English, that means that health is at the end of the line. All these other things impact health, where you live, whether you have a job, whether your home is safe, whether you the climate, heat and flood, and all of that Australia kind of flood, drought, fire, rain, your social supports, your access to care, they all have an impact on how good or bad your health is. So those strategic big picture issues is, does your region have high unemployment? Has your region been heavily impacted by COVID and long COVID? Has your region got geographic issues with climate change? It's getting hotter, it's getting more tropical, mosquitoes, more tropical diseases. COVID, mental health issues are, higher because of these long periods of lockdown and, impacts on education and kids' school. All of those things will play out in our health system in the longer term, those longer term, bigger issues that will impact your strategies at your health service, hopefully putting together with you, thinking about the needs and those big issues that affect the needs of patients and the community. So social determinants, thinking about those, and also geography as well for your particular region, because access to care for some health services is a significant issue that will impact patients and community in a huge way. So knowing your sphere of influence and communicating for impact. So next slide, please. The engagement spectrum. Hopefully a lot of you have seen that. It's from this book, which is downloadable, and hopefully you've got a copy. It's a fantastic Bible, but this is also a thing for your toolkit, because all these levels of engagement are valid and they all have their role. They're all important. There's not one that's more important than another. They all have an important role. However, if you want to really be strategic and actually influence those big issues, those vision, those outcomes and activity, then you need to get involved earlier. You can't just come in at the spell checker phase to point out to the health service the document's missing an I dotted or a T crossed. You actually have to engage earlier, because then you get to do more of the collaborate and consumer led. And there's different versions of this picture, and some of them actually call the last three, inform, consult, involve, tokenistic. And it's only when you do the more collaborate and consumer led are you doing genuine consumer engagement. So knowing that, and how you can use that in your toolkit is when you're engaging, if it's not already made clear, you should probably ask and go, are you expecting me to just have an inform level, just read over something and pass to my networks and spread it around? Or do you want me to consult and give some input? Do you actually want to involve me in the process? And is this a collaboration activity? Or is this something that me as a consumer with other consumers, we can actually have a go at leading this with support about the design, the project management, but importantly, the health services supporting that. Otherwise, you're being set up to fail. So knowing what kind of level on the engagement spectrum activity is, and remembering in a committee, you may do all of these things in the one agenda, and knowing what the expectation is can also empower you so that you can do this in the best way. Okay.
Keren, it's Tash. Sorry, can I just ask you a quick question?
Yes.
Can you go back? Thanks for that, Arima, going back to the slide. So, I mean, you and I have known each other for a long time. So with that, and in Metro North, you know, we've now got a new framework and we're moving forward to more co-design stuff. And I hear what you're saying about us asking the questions, but have you ever been stuck somewhere knowing that maybe collaborate or consumer led would be, from a consumer point of view, you sit there and go, look, really, we think we should be doing it this way. How do you have those tough conversations where they won't budge from consultant where they won't budge from consult up to collaborate? Like how do you have those tough ones? And have you had any, or if anyone else, have you had one? What did you do?
Absolutely, all the time. So many experiences, and some positive and some negative. So and I've got a slide where I talk to this more, but I hear you, Tash, and I think it depends on the people that you're dealing with, and whether you can, because you've got to know them more, that you might be able to have, it's far easier to have the difficult conversations when there's more of a relationship there. And if you don't have a relationship there, then you might need to find someone that, I call them gatekeepers, and you can Google that and you can find some really good articles about using gatekeepers. The people, they may not be the person in the top job, but they're the person that has a level of influence in the health service. And you can use this guide and go, how about it? Like, there's examples in this guide that actually show how it can work. And it could be like, hey, is this an opportunity to do more of this? Because we know when you do more of this, it will actually show more favourably when you're doing accreditation. It will probably help you meet your consumer and community engagement strategy, which they're legislated to do, and they have to do every 3 years, and they have to measure how they're going on it and showing their continuous improvement. So you know all that now, and you go, knowing that environment and context they're working in, it's like, how can we help you help us? Because knowing that you've got to do it, and you can do this better if you're doing things more at the collaborate and consumer led, and use the examples in this book, this could be an opportunity to trial and see how it works. And let's see how it goes. And if we get it working, maybe then we can do more of this, but let's try it and see. Safety first, do an agile approach, which is a pilot, a prototype, safe to fail. These are all keywords in your toolkit that you can use to advocate for change. And it's very hard to do all of that, even with all that language, if you've got a brick wall or someone who doesn't get it and hasn't done the Health Consumer Queensland staff training. So you need to find the gatekeepers in the system who can open those doors if you present it in a positive, a solution, and all those words in your toolkit, and give it a go. Yeah. So in use of time, outcome versus activity processes. Okay, so this is one of my navigating as a health consumer in our health system. I see lots of activity and lots of process and not so much outcome focus. So in your toolkit today, so next slide, please. So this is why we need to focus on outcomes, not activity, because patients have the most to gain and the most to lose. And focusing on the patient and holistic outcomes like integrating care will create a better value health system, more high value, less low value care. And these are all buzzwords for the health system. They love it because they know they have sustainability issues. And so anything that's going to deliver more efficient, better outcomes for patient is stuff they need to do, or services will be cut. And we need to reduce the power and information imbalance to make things more equitable and efficient. And if any economist or anyone who's done any economy studies in the room will know that the bigger the gap in power and information, the more inefficient a system is. And health has some of the biggest gaps in power and information. So the more that you as a health consumer can help drive the goals, drive the vision that the health service is working on, do more of that consumer-led, collaborate type activity, the more that you're going to reduce the power and information imbalance, and you're going to help patients and deliver a better health system. So know that in your core. Next slide, please. So what to look out for and listen for. So these are, Tash, probably some of the red flags. Next slide, please. It's when they don't want to collaborate or consumer-led. They want to do more of inform and involve, which I call the spell checker phase. So it's already written, the issue's already decided upon, and they've mostly got the outcomes that they want. That's a red flag. Another red flag is when governance structures change. For example, boards no longer attend your committee meeting, or the way a consumer group or a working group where it fits into the org structure of the health service is reduced or lowered down. When you have changes in attendance, when you don't have decision makers and leaders attend your committee meetings anymore, when you notice that there's lots of listening, but there's no follow-up or no timely follow-up. When you hear answers like there's a policy and process, we already do that. And you can't talk about individual issues. That's another way to stifle strategic consumer engagement. So next slide, please. So how to get around that? So these are some things that I have used that you might be able to use to ask to try and get around some of those red flags. So what's the outcome we want for patients in the community? So when something's presented, how does this help patients in the community? Put that lens on, ask those questions. What goal, consumer and community engagement strategy, or what standard 2 action does this align to? So that you can say it doesn't align or it does, and use that to help drive a community and patient-focused activity and outcome. What is the underlying issue from a patient perspective? You know, we know that staff will have a perspective, the health system itself, but what's the issue from a patient perspective? Because that's why you're there and that's why you're needed, that unique patient perspective. Is this an issue for and priority for patients in the community? The health service may think it is, the staff may think it is, and they are important stakeholders, but they're only there because of patients in the community. So what's the issue and the priority of that for patients? Does this help or unintentionally increase health inequities and inequality? So we don't want to do anything that makes things worse for the most vulnerable patients and community members. And finally, how can we measure success? You don't just want to do something and go, oh, well, that was nice. How do you know that you were there and that you actually delivered something? That's that feedback loop. Next question. Slide, Chloe. What to do when things get tricky? So having been there and done that, I talked a bit about this before. Who are your gatekeepers or advocates? It could be your board chair. There are some health services and consumer groups who have very engaged listening board chairs, and there's others that I know don't. So if you're one of the lucky ones, they could be a huge advocate for you, or your committee chair. There can be some executives, and there can be some leaders who may not have an executive title, but they are extremely respected and listened to in the health service, and they could be your champions as well to help push through change and getting issues done. Health Consumers Queensland are also a good resource, and other consumers. I've learned more from other patients, life-changing, quality of life-changing things from other people in the trenches, different trenches. So other health consumers can also be huge advocates for supporting you. And another key message, the only constant is change. If things are bad right now, it will get better because people and roles change, committees change, strategies change. The only constant is change. And as a kind of caveat as well, when things are working really well and you've got good engagement, good listening, good attendance, good action, good outcome focus, unfortunately that can change too. And that's why you need to think bigger picture and, for succession planning and what to do when people and roles change and how to mitigate that. And finally, and I've had to do this myself, the previous slide, please. Time to engage, not time to waste. And I'm sorry I've gone over time. Sometimes you have to walk away because you've got time to help, but not time to waste. And you might have to wait till that system changes and people and key roles change. And finally, look after yourself. So that's the presentation. I could probably talk for hours, and I'm so sorry I've gone over. I know there's been lots of questions in the chat, and maybe we can do some more of this, but I hope we've answered all those things in the goals for today. I will look through some of the chat as well, and I hope that's been really helpful. And can you please fill in the evaluation so we can learn and do better? And also we'll send some of these slides, and I'll put some key links as well.
Thank you, Karen. I feel like there's so much that you can share. If you're okay to stay for 10 more minutes, if people have questions, could we do that now, or you've got to head off as well?
No, I can stay. And I'm sorry, I wanted to have that 10 minutes ago, but
there is a lot to share, and I think that we need to do a few series of these sessions. And there's lots and lots of people who could contribute in those sessions as well. So Sandra has a question for you, Karen. Sandra, do you want to unmute?
Yeah, hi, Karen.
Hello,
I have met you
Sandra.
actually up on the Sunshine Coast for memory.
Oh.
Yeah, I'm just wondering, I actually founded a cancer support group for women here on the Gold Coast, and I'm on the Gold Coast Hospital Health Services, CAG and PHN. I'm actually just dealing with a conflict of interest at the moment. And I'm wondering if maybe I can talk with you maybe away from here, because it could be quite involved. Just after listening to everything that's gone on this morning, I've been a little bit mouth agape because I wasn't aware that we should have this much power. I've felt very dampened, not encouraged. A couple of my things have been referred to the feedback place, which I felt they're really important issues. One of them is medicinal cannabis. And we've got a few ladies that are obviously using that. So I'm just wondering if I can talk a bit further about where the line lies on the conflict of interest, because I haven't actually got a reply back from my reply.
Okay. What's your conflict? Because you run this breast cancer support group.
Yes.
Well, I'd have to hear the details, and maybe that's
right.
something we can talk with Health Consumers Queensland about. But I actually think the support groups, the patient advocacy support groups for different chronic conditions, are one of the most powerful networks and important networks for consumer engagement in the health service. It's not a conflict, it's actually a positive, but that's just not knowing the details.
Yeah, no, I was invited to join the CAG because of the group, and we've got 650 women in our group now, so I consider it quite a strong voice. Yes. So can I perhaps talk to you later on if I can?
Happy to, and maybe, you know, Health Consumers Rima or Chelsea or you know, Joe, Declan can help be part of that conversation, but happy to share my knowledge for what it's worth.
Thank you. I didn't want to take up everyone's time. That's all. Thank you very much.
No worries.
Lee has a question. Hi, Lee.
Hi, Lee.
Hi. I'm on the Sunshine Coast, and I think that we get quite a lot of good support from our health system in terms of consumer consultation. But we're often coming up against issues that, in fact, the hospital staff recognise an issue, but they're powerless to do anything about them because they're managed from Health Queensland Health, not within the service. So things like over and over and over again, we hear consumers say, we want to get our appointments via email, but they only come by mail, and half the time the appointments pass before you actually get the letter of appointment. And our health, you know, that must be an issue that is duplicated across every system, every area in the state, and it's costing us a lot of money in inefficiencies and missed appointments. But our local health system can't really do anything about that because the software is controlled by Queensland Health. And so there's a limit to the field of influence. But how do we actually work out the pathway of influence to in fact have that simple little thing resolved?
That's very interesting. And this is part of the challenge of our health service, is that we are, at the moment, the setup is quite decentralised. So we have 16 hospital and health services, and they're effectively fairly autonomous, with Queensland Health Department over the top. And that cross-horizontal engagement does happen, but things like this show that it's not happening the way that it should. So the things that I would be asking is up the line is what avenues your staff member that you're talking to, what statewide networks are they participating in where they can raise this issue appropriately and learn what other health services are doing. Because there are definitely other health services who have used technology with SMS messages and the like, and I'm, you know, never shocked when I hear some of this stuff, but that are doing this already. And especially if it's more of a regional health service, you know, you can't rely on the mail, so it becomes even more important. So it's that, what's the statewide connection that your staff member can raise? And the thing that I'm learning more and more is that sometimes you have to escalate higher to get a response. And the statewide network is the level above, and then it might be a considered response from your consumer group to your executive and to your board that's in writing. And then that can also then, if you don't get the response, you can go higher again. And I'm happy to talk offline about ways to do that as well. But I know when things get put into systems, it does require an official reply and it may get action. And there's definitely health services who are doing appointments better, including in regional locations. Any other questions?
Phil's got his hand up. Hi, Phil.
Good morning and
Hello, Phil.
hello, Karen. That was a great presentation. It's full of facts and figures and good provoking thoughts to carry on. Two things I wanted to mention quickly. Government election promises are incredibly important things to make sure they follow up on. But that also means that, for example, things like the new satellite hospitals. I asked in my board, my executive committee as a consumer rep, who is designing these hospitals and would there be space for things like, e.g., dialysis? And the word came straight back from the chair that the satellite hospitals were being designed centrally as a cookie cutter and they wouldn't be taking into account any local needs or special issues, which I think is an incredibly difficult thing. It's just wrong that all this money is going to be spent on building these terrific facilities, hopefully, but there's been no local consultation about design or about priorities or about what the local people really want. So I was told just to drop it, and there was nothing that they were willing or able to do about it.
So Phil, I would agree with you there. And that's probably, again, putting that kind of strategic lens on, and information is advocacy, and being aware of the context that we're all operating in at the moment can help manage expectations and also help how to work around things if possible. I don't know about how to navigate around the roadblock, because if you're hitting that roadblock and your level of experience and your, professional background and knowledge, then that would mean a lot of the rest of us would also have a lot of trouble. And sometimes we have to unite. And, I know that Health Consumers Queensland have done some of this stuff where they, has taken targeted letters to the minister or premier or above, and maybe some of these issues we need to do some of that with. But the context that we're working in is a post-acute pandemic context. Sustainability is an issue. We have a new deputy, a new director general. We have a reform agenda. We have a very much, in my opinion, a cost and activity kind of agenda as well. That's the reality, and it's not a great reality. You can see the economy slowing down, interest rates, unemployment, housing, energy, electricity, all that will affect our health services and the stress and pressure that they're under. And unfortunately, when people and systems are stressed, they stop listening and stop engaging. And that will take every one of you in your spheres of influence to hold the line and network and empower each other and support each other and go higher when you can. There still will be good people who, in spite of the stress, in spite of the being asked to do more with less, who will help, because they see that if you focus on patients and outcomes, you actually deliver longer term solutions. Because this context, unfortunately, will mean there will be a lot of pressure about short term and